Hi everyone, my name's Deanne. This is a video on how to give yourself a Lovenox injection. Lovenox is an anticoagulant and it's a deep sub-Q injection, so it just goes under the skin. If you found this video, you might have searched factor 2, factor 5, anticoagulant, Lovenox. I am currently in my 4th pregnancy, and due to some miscarriages, we discovered I have a factor 2 genetic mutation, heterozygous mutation. Factor 2 is also called factor G20210A, and so basically I'm at an increased risk to clot. So I have been prescribed Lovenox, and Lovenox has been given to so many patients. It can treat DVTs, it can prevent DVTs, it's a prophylaxis for going into total knees, total hips, lots of different surgeries. So anyway, this video, as I said, is a step-by-step how to give yourself a Lovenox injection. So there's a couple things that we need getting started. We need to have a sharps container, and every state has their own individual rules as far as disposal of needles, so you'll want to look into that before you get started. And you need, of course, your Lovenox pen. These come in month prescriptions, and every pen is a daily dose. Lovenox for prophylaxis for DVT, which is what I'm on it for, is a 40 milligram once a day sub-Q injection. So each day I give myself an injection, and then I put that needle into the sharps container. Also, alcohol swabs. These help to just clean the site. Okay, as far as the injection goes, the number one thing we want to do is make sure we wash our hands well. Secondly, we will also want to clean our site, so I have some alcohol swabs, as I mentioned. A couple things to keep in mind. This is a deep subcutaneous injection, so you do want to get a little bit of skin when you're doing the injection. You can contrast that with diabetics on insulin that have a very, very small subcutaneous needle. They're still getting the medication under the skin, but with Lovenox it is a longer needle. Secondly, we want to be cognizant of where we did our last injection, and we want to make sure that we're alternating sites. Also, I'm an RN and I give this medication sometimes multiple times throughout my shift. And I've noticed a lot of nurses tend to give the injection around the belly button area. Ideally, and also according to the package insert, you want to give the injection on the anterolateral and the posterolateral parts of the abdomen, which are basically your love handle area. So just the whole side area, which I'll show you in a few minutes. I think that's it. So let's go ahead and get started. We've washed our hands. Let's go ahead and clean the site. And I'm going to step up on this pedestal so you can see a little bit better. I last did my injection on this side, so I'm going to go on this side. So I'm going to clean the site really well. Another thing to remember is we want to give this time to dry, obviously. You don't want to inject alcohol into you. And Lovenox, as it is, can sting. So okay, so here is my pen. I'm going to go ahead and open it up. This is my Lovenox injection. This is, as I mentioned, a daily dose. So we're going to take off the little shield cover here, and you can see the needle. You can see how it's definitely longer than a diabetic needle. So we really do need to make sure it's a deep subcutaneous injection. This right here is the plunger, so we're going to push our medication in. You'll notice if you turn around your Lovenox, you might see a little air bubble in there. That's okay. Don't try to get rid of the air bubble. Just go ahead and do the whole injection. Okay, so I've cleaned my area. I've given it time to dry. I'm going to go ahead and hold onto the plunger and get a nice big chunk of skin here. Okay, and I'm going to just go in. Another thing with injections, you want to go in not super fast and also not really slow. But this is the part that really does not sting. It's more of just the medication. So can you see that okay? 1, 2, 3. So now we're inside, and I'm just going to squeeze that medication in. Once it's all done going in and I can't push the plunger anymore, don't push the plunger too hard now. We want to take it out. All done. I'm not going to rub the site. I'm just going to leave it alone. And then you'll notice you still have your needle here. You want to go ahead and push on that plunger even more to engage that safety shield. Okay? Then when you have your safety shield on, then you can go ahead. You won't re-poke yourself. Obviously, it's for safety. You'll put that back in your sharps container. And that will, you can add to that as we go each day. And that's it. That really is all there is to giving yourself a Lovenox injection. Sometimes it stings, sometimes it doesn't. This one went well for me, but yesterday's wasn't so great. But I do think if you can watch those things, like don't rub it, stay on the love handle area, you can definitely minimize the bruising. Best of luck to all of you, and I hope this helped.